Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart, Life as a Dad and a 35-Year Cancer Survivor, available on Amazon. You can also find me on YouTube on the channel at Paul's Heart, PaulsHeart. I'd like to take a moment and talk about the role of your primary care physician in your life after cancer. You know, that period of time, usually 5-year mark, and your oncologist said, okay, you're free to go now. We're pretty sure that your cancer is gone for good. There's no reason that I need to see you. As a long term cancer survivor, I know that I have seen there's a reason for you to continue to see a doctor after that 5-year mark. No, it's not because of fear of your cancer returning, but there is a possibility, not a certainty, but a possibility that you could develop some late term side effects from the treatments that you received, whether it was radiation therapy, chemotherapy, immunotherapy, or whatever. And it's important that you keep in touch with a doctor to follow up for those potential side effects if they should happen. Again, they're not guaranteed to happen, but if for some reason something does develop, it's better to catch them before they happen. Now, the common question would be, well, what exactly is a primary care doctor going to do? Cancer's not their expertise. Well, they're not looking for cancer anymore. They're looking for symptoms. If you have any developing problems, okay, and your primary care, if educated or communicated with properly by your oncologist, with the list of the treatments and the potential side effects to look up for, can order tests that will look for those potential issues to develop. For instance, one particular drug that's used in the treatment for Hodgkin's lymphoma is called adriamycin, or even radiation therapy. Many patients get that. Okay, there's a known potential for damage to the heart. Therefore, it's not unreasonable for it to be expected to have biannual, like every 2 years, some sort of echocardiogram or an EKG, some sort of heart study, just to make sure that the heart is working the way it's supposed to. Now, obviously, your primary care doctor orders that test, and if it comes back with some sort of concern, the primary care doctor then would refer you to a cardiologist to deal with that. Let's use another example. You go through radiation therapy, and your primary care doctor notices some blotches on your skin, potential for skin cancer. Again, your primary care doctor would probably refer you to a dermatologist then. You see, that's the role of the primary care doctor. Take charge of your care, send you where you need to go, but in order to do that, they have to know what to look for. Okay, there are many resources available. I can only quote for Hodgkin's lymphoma, since that's the cancer that I dealt with, that have recommended guidelines of what to follow up. There's the Children's Oncology Group. They have a website, as well as what's called a survivorship guide. You have Hodgkin's International, a nonprofit organization that was developed by Hodgkin's survivors, with input from both patients and doctors, who came up with a survivorship plan of issues to be on the lookout for by your primary care doctor. So again, you're not seeing a primary care doctor to follow up on your cancer anymore, but for the possibility that there are any potential side effects, and better to catch them early before it's too late. So just something to keep in mind, some advice from me. I've been here long enough. I'm approaching my 36th year in remission. I do see quite a bit of doctors for late effects. I am one of those that did develop side effects. It took 18 years before the first one, came forward demanding attention. But I still find a way to enjoy life, even among all the doctor appointments that I have. Um, you know, I have two daughters that I'm getting to watch grow. They're in their early adult years now in college, something I didn't think I would ever see. I'm approaching my 60th birthday at the end of the year. These are all things that I never thought I'd see as a long term cancer survivor. Yet here I am. And it's all because of my primary care doctor having the openness, the willing to learn about these potential side effects, and the knowledge of where to send me when something does come up and it needs to be taken care of. Until next time, this is Paul's Heart.